Good afternoon. My name is Ray Uttenhove, and I have the pleasure of chairing the Women's Philanthropy Network. Welcome to our webinar today on understanding the educational impact of COVID. This is the first of two programs on the pandemic and how it's affecting the lives and the livelihoods of women. WPN's mission is to bring our supporters together as philanthropists and activists to learn about the most important issues that we face as women. Gender equality is a foundational pillar of our work, and we all know there are some real headwinds that we're facing, and we're going to address those today. Women have stepped up in amazing leadership roles during this crisis, but women are disproportionately affected by the virus. They carry a heavy load when it comes to childcare and educational support, and COVID has increased the burden of unpaid care and all of the anxieties that go with virtual education. So today we're going to talk about the challenges that moms and their children are facing. And we're also going to look at solutions and opportunities that are coming out of this disruption. We are so fortunate to have Cathy Henson with us. She chairs the WPN Education Committee, and she's done a number of our seminars, so you may remember her from previous programs. She's going to introduce our panelists and facilitate the conversation today. So Cathy, I'll turn it to you.
Thank you, Ray, and welcome everybody for joining us today. As Ray said, this pandemic has affected everyone, some more than others. Today, we're going to focus specifically on the impact of COVID-19 on our school-age children. And our next webinar will focus more specifically on the economic and emotional impact on women, specifically women who also have school-age children. But today I want to talk about where we are in terms of our school-age population in Georgia and what we can foresee in terms of getting them back on track. Although I'm a graduate of the College of Law here at Georgia State, K-12 public education is near and dear to my heart. I actually started out as a 7th grade English teacher when I first graduated from college in upstate New York. And after I moved to Georgia and went to law school and practiced law for a few years, I decided that practicing tax law was not near and dear to my heart, and I returned to my roots and the love of education and education policy. And at one point in time, I served as the chair of the Georgia Department of Education, and I saw up close and personal the challenges that this state faces when it comes to providing equitable and adequate education to our K-12 student population. So I'm delighted today that we are going to look at this situation in Georgia and see what, if anything, we can do to help. I'd like to start, however, by talking about the pandemic more generally and its impact on Georgia State and specifically the College of Public Health here at Georgia State. And so I'd like to introduce to join me Interim Dean Rodney Lynn, who oversees the School of Public Health here at Georgia State, to talk about what it was like to be in this position when the pandemic of a lifetime hit our lives. So Dr. Lynn, if you would join me and talk a little bit about how your life has been these last, I guess now 13 months as we're going on over a year.
Yes, let me start, Cathy, by thanking you and Ray and the Women's Philanthropy Network for hosting this forum and to focus on the impact of this pandemic on our children. I think this is a really important topic, and I'm really pleased to have the opportunity to be with you and the other panelists to talk about this today. Yes, the last year plus has been a bit of a whirlwind, but I think I'm not alone. I think many of us have felt the forces of COVID-19. In the School of Public Health, we've been called to contribute in a wide variety of areas, including the response of the university to COVID-19 and all the actions that the university has taken to mitigate and prevent the spread of COVID-19 on campus, to keep community members safe, as well as been a resource to the community and to different sectors of society as they've tried to navigate this space as well. Remembering we did a webinar with the arts community that was really trying to figure out how do we open back up? Is that possible? What's required? So we've really tried to use the resources and expertise we have to support our community here at Georgia State and more broadly in Atlanta and the state of Georgia. So, public health has certainly been in the spotlight for obvious reasons. One of the things I realize is that people now have an understanding of public health as through epidemiology and infectious disease, and I think that's great. I just want to take the opportunity to also let people know that our mission more broadly is really to prevent illness and disease and to promote health and well-being at a population level. And so we do that through a variety of areas here in the school. We've been doing a lot of research in the area of COVID-19, certainly in epidemiology and biostatistics, where we've looked at patterns of transmission and risk profiles and statistics, really modeling and forecasting where the virus is heading. But we've also done work in environmental health to look at disease transmission, health behavior. Why are people hesitant or not as confident about the vaccine? In maternal and child health, thinking about child well-being and health policy as well. And so, across this period, I think we've had over 600 citations in the media just because of our expertise and that we've been called on. So we're really happy to be with you this evening to talk about the issue at hand, and look forward to a rich conversation.
Thank you. Let me ask you, Dr. Lynn, I know that the national statistics show that college enrollment dropped about 13%. I don't think we saw that at Georgia State, and I think specifically at the School of Public Health, you're seeing overwhelming increases in enrollment. Is that right?
Yeah, well, yes. And, we feel fortunate that in this environment that we've not only maintained our enrollment, but we've grown it. And again, no one would wish for a pandemic, but it really has, I think, illuminated the importance of the work that we do in the School of Public Health. And it's, really put public health in front of young people who see it as a career path, and they see an opportunity to really make a difference in the lives of family members and in their communities more broadly. So we're really excited about the growth that we've seen. The U.S. Bureau of Labor Statistics is projecting a 25% increase in the need for epidemiologists, which is the highest among the 800 occupations that they look at. So that's, again, encouraging. And then the last thing I would say is just that, the recent American Rescue Plan Act, the $1.9 trillion COVID package, includes $7.5 billion for expanding public health, the workforce, and strengthening the infrastructure in public health. So while the details of how that will be spent remains to be determined to a large extent, it really gives us hope that there's going to be investment that will create a stronger public health system and opportunities for our graduates to really make a meaningful difference in their communities.
And as a layperson, can you tell me what are some of those careers that our graduates are prepared for?
Sure. And I mentioned some of the areas, but, obviously infectious disease epidemiology and really looking at patterns of disease and helping to intervene to mitigate those risks. But also, if you eat in a restaurant, that restaurant has has to go through an inspection and be scored. So our environmental health graduates contribute there, but they also contribute in areas like understanding occupational environments. They also look at surfaces. There was a lot of discussion early in this a pandemic about does the virus live on surfaces, and if so, for how long? Those kinds of questions. I mentioned health policy. We're all familiar with health policy in the healthcare system, really ensuring people have access to the healthcare that they need. And then what are the ways that we can structure the environments that people live in, neighborhoods, communities, in a way that it's opportunities for healthy choices and healthy behaviors become easier, whether that's around diet and activity, whether that's about the quality of the air that we breathe. What are the things that we can do programmatically and otherwise to provide opportunities for children, families to engage in the kinds of activities we know matter for health over the long term? So, we have 5 different disciplines. We could add, global health as another area of focus. So there are lots of opportunities to get engaged in public health.
Well, thank you. And I know your expertise will be very helpful in helping us understand the challenges in getting our K-12 population back in schools, along with all the adults that are required. So let me introduce our panelists today. One of your colleagues is Dr. Brian Williams from the College of Education and Human Development here at Georgia State, who's also the director of the Alonzo Krim Center for Excellence in Urban Education, and Dr. Erica Sitkoff, Fener Sitkoff, who's the executive director of Voices for Georgia's Children, both of whom have spent a lot of time thinking about the impact of this pandemic on our K-12 population. And before we start, let me give each of you an opportunity to talk a little bit about what you do. Erica, I'll start with you if you want to give us a little summary of what Voices for Georgia Children is and does.
Thank you. And thank you, Cathy and Ray and the Women's Philanthopy Network for having me today. Voices for Georgia's Children is Georgia's only comprehensive child policy and advocacy organization. We advance laws, policies, and actions that improve children's lives, particularly those that are furthest from opportunity. That's everything from laws that are passed under the Gold Dome, the state capitol, to priorities within state agencies, to legislation that's passed at the federal level. And we do that across all areas of child well-being, health, mental health, early care and learning, education, school discipline, child welfare protection, safety, and juvenile justice, and out of school time, and across all age ranges. So that gives us a pretty unique opportunity to see where a lot of those challenges and opportunities for solutions and investment intersect. And I think we'll hear about a lot of that today.
Thank you, Erica. And Dr. Williams, I know you have both a teaching role and an administrative role in the College of Ed.
Yeah. So, Cathy, I'll echo my fellow panelists from saying thank you for inviting me. I'm really excited to be here. Thank you for you and WPN and Ray for putting this panel together. I think it's a really important topic that we're talking about today. So I have 2 roles in the College of Education. I serve as a professor in the Department of Early Childhood and Elementary Education, where I work with teachers. So I teach teachers for a living, specifically those working in elementary schools and those working in the urban context, so those working in urban communities. In addition to that work, I serve as the director of the Alonzo Krim Center for Urban Educational Excellence, affectionately known as the Krim Center. And we serve as that connecting point between the College of Education and the Metro Atlanta community, and I would say the regional area of the United States, the southeast part of the United States, given the history of the United States, unique history of the southeast United States. And the work that we do is in 3 big buckets. The first being kind of direct service, where we do programming that serves our local schools and communities. We also do research and policy work, trying to answer some of the more pressing questions that are facing our communities and our schools. And then we do technical assistance, and that's where we attempt to help other people do what they do better. And all these things are serving our mission to provide excellent and equitable school opportunities for children in urban communities. And that's kind of the work of the Crim Center. We've been around since 1996, and I've been leading for about 8 years in the center now.
Well, thank you, and my sincere appreciation for your participation today. I couldn't have asked for a more informative and easy to work with group of panelists, so thank you.
Of course.
I'd like to start today by putting up a slide that shows what our K-12 student population looks like in Georgia, so we all have an understanding of who it is we are serving. And we're looking at public school enrollment because over 90% of school-age children go to public schools, and that's what we are most concerned with here today. The current data, and many of you will know that it's hard to get current data depending on what agency or entity you're dealing with. So this is as accurate as I could get. Our current student population in K-12 is about 1.7 million students. The demographic breakdown is 39% white, 37% Black, 16% Hispanic, 4% Asian, and 4% other. An important metric when we're talking about the K-12 student population in Georgia is the percent eligibility for free and reduced lunch, which is used as a poverty metric in this state. 60% of all our students are eligible for free and reduced lunch. And to put that in context, that's over 1 million students. And I'm not sure what the poverty standard, the FRL eligibility standard is today, but a general rule of thumb is that it's a family of 4 that makes less than $24,000 a year. The next metric that we need to look at is the percentage of our student population that qualifies for special education services, and that's nearly 12%, followed by 8.2% of our student population who qualify for limited English proficiency services. So if we just look at these last 2 percentages, and there is some overlap in the student body, almost 20% of our students qualify for some special program. They have particular needs and deficits that need special programming. And then you overlay that with 60% of our student body eligible for free and reduced lunch, essentially under the poverty line. You see that we have a student population that is extremely at risk. So if I could bring the panelists back in, and I want to start off by talking about where we are today. We'll revisit where we've been, but in terms of where we are today, let's start, Rodney, talking about the CDC has finally issued some clear guidance about the circumstances under which schools can meet in person. And I'm not exactly sure if any of us know what percentage of our schools were totally online, hybrid in person, totally in person, but we are where we are. And can you talk a little bit about what that guidance is, what those guidelines are, and what the hurdles are that schools have to clear in order to get all our students back in a building?
Sure. First, let me say that, and Brian knows this and Erica better than anyone, there's great variation in the resources that our schools have available to them to respond to these urgent demands. In terms of where we are today, the CDC has indicated that 3 feet of social distancing is appropriate inside the classroom. It was previously 6 feet, which many schools said this is impossible. There's no way for us to open with this requirement. So it's 3 feet of distance as of a couple weeks ago, as long as the students are wearing a mask and as long as community transmission is not high. In addition, CDC continues to recommend good hygiene, hand washing, staying home when you're not well, ensuring that there's contact tracing, isolation, and quarantine happening as a part of what the school is doing maybe in partnership with local public health officials. The other thing is air filtration and circulation being critical as well. They've asked schools to look at the filtration systems that they're using and upgrade those, and to increase ventilation in the school building and in classrooms. And generally speaking, an open window is better than a closed window when at all possible. And then the other thing is, their public health officials are certainly encouraging, as do I, encouraging vaccination among K-12 teachers, and K-12 teachers have been prioritized in Georgia. Additionally, now high school students 16 and older are eligible to receive the Pfizer vaccine. And we just got news this week that 12 to 15-year-olds who were part of a trial with that same vaccine, there was 100% efficacy in that age group. So I would expect, Pfizer to apply for emergency use authorization and for that to follow in the weeks ahead. So I think increasingly we have a situation where the adults who are most susceptible have, hopefully access to the vaccine. And we now have guidelines that certainly increase our ability to create a safe environment for students.
Thank you. So Brian, we've had almost a year of kids out of school, online school, in-person school, and now we're going to try to get them back in-person school. What are the challenges of knowing where they are academically?
Yeah, I think that, echoing Rodney, there's going to be quite a bit of variation with regards to our kids and where they are when they return to school. I think that it's important that we acknowledge, we'd be naive not to acknowledge that learning losses in public education are not new, right? I don't think that they're actually connected only to COVID. We knew that there were certain children that were not being served by our schools prior to COVID. This is not new, right? So we've had learning losses in our school for a long time now. I think that, one of the big challenges for us is that traditionally the way that we've thought about assessment or trying to understand what our kids know or don't know in terms of the system has been rooted in standardized testing, these large scale tests that we tend to give to children. That's probably not going to be very effective going forward for really understanding what our children need and what they have learned and what they have not learned. I think some would argue that it probably wasn't that effective in helping us to improve schooling in the past. And I think it's important to realize that when it came time to let go of those tests, we did so pretty easily. When we decided, we're not going to give the test this year, we let go of those tests. And so I think that's important for us to remember, that we can let go of things. COVID showed us that we can let go of things that we thought were very important to us into public education. So I think moving forward, if we really want to kind of understand what our kids know or what their learning losses were, I think we're going to have to rely more heavily on our teachers. Surprise, surprise, from somebody that works with teachers, that would be my stance. But I believe in the power of amazing and really very well-trained teachers. And so I think helping our teachers to really dial in on what our kids know or need to know, helping them to utilize formative assessments, right? So we can use assessments of learning. We can also use assessments for learning. For the longest time, it's been assessments of learning. These are assessments that we give at the very end, which don't really help us to improve our kids' learning or improve our teaching. If we transition to assessments for learning, these are formative assessments that teachers use throughout the school year, throughout the day, with students to kind of understand where they're at. I think that would be a transition that would allow us to really understand where our kids are at. I think allowing our teachers to begin to have conversations with each other that go across years. So second grade teachers talking to third grade teachers about where the children were, how much content they were able to cover, and preparing that teacher to kind of move forward with those kids. You know, there are schools that will do things like looping, where you'll allow a teacher to stay with kids. I mean, sometimes that's logistically challenging, but there are ways for us to provide the next teacher with the knowledge base that they need to adequately serve those kids. And that may be just talking to the prior year's teacher. And I think the other thing that we can do is to think about the amount of information that our teachers are going to be responsible for actually teaching in that year, allowing them to talk with each other about expectations for coverage in that year, so that we can actually set some reasonable expectations with regards to what our children are going to learn in the year coming up, right? So I think at the end of the day, we're going to go back to teachers to assess what students know, what they don't know, and what they need to learn. Now that's going to mean that we're going to have to look very closely at the profession of teaching, right? And who we have invested in. We've made a significant investment in this country in poorly trained teachers, or people who are not teachers at all, coming into some of the schools with the highest needs and working for a year or two and then going out of the door. And I think that that's not going to work going forward if we're going to have this expectation that our teachers are going to be responsible for not only teaching but assessing what our kids know and need to learn. So I think we're going to have to support those teachers, and we're going to have to protect the profession of teachers moving forward.
Let me follow up on that. I remember reading years ago a statistic that said the single most important predictor of whether a student would graduate from high school is if by the third grade they could name a teacher that they had had a meaningful relationship with. And the importance of teachers cannot be understated. And I totally agree with you, is that we have not prepared and trained teachers adequately for the student populations they're dealing with. And if you looked at teacher quality as an asset, it's not deployed equitably, because often the neediest students get the most ill-prepared teachers. So I am gratified to know that you are staying up nights thinking about how to solve this problem, probably every day doing what you do, because teacher quality, it doesn't matter how many kids in a class, it doesn't matter how much money. If you don't have teacher quality, a teacher in the front of the room who knows their subject matter and can connect with the children, all those other things are just rearranging the deck chairs on the Titanic. So I really appreciate you doing what you do. So Erica, let me switch to you and say, so we have kind of the public health challenges to grapple with. We have the academics to grapple with, but we also have the social and emotional preparation for both kids and teachers who haven't been in a classroom in a very long time. What can parents do? What can teachers do? What can we do as a society to help with that transition?
Thank you, Cathy. And I think you'll hear a lot of echoing of some of the themes that Brian said. I love and really appreciate the theme that ran through his response of these challenges are not something new, and managing expectations and the important role of teachers. So going into the pandemic, our kids were struggling greatly with mental health and food access. A lot of these challenges that we're looking at now during the pandemic are not necessarily new challenges. They're just those that have already existed that are magnified. And with that in mind, we are entering in-person school, or going back to school, with some students, like you noted, haven't been there in over a year. There's a tremendous amount of anxiety and stress about what that's going to look and feel like for both young people and teachers. There's a lot of internalization that students are having of this idea of, quote, lost instruction or learning loss, about what that means for them And so reassessing what our expectations are of our students and of our teachers, and setting those right versus placing all of the expectations on what students are going to be capable of doing, what teachers should be doing. But the system itself needs to relook at what we expect. That said, not only taking into account, like you said, of physically what they need, but social emotionally what they need. And a big part of that is going to be interacting with students, and as Brian said, teachers having conversations. So we could do all the screenings we want to, and all the questionnaire, but a lot of it's just going to come out in those interactions that kids have. I mean, we saw that that was very evident when in the month following the pandemic, when schools first started and schools went virtual, and we saw a 50% decline in reports of potential neglect and abuse. Because a lot of what we know about how children are doing, social, emotionally, food, housing, all of that has to do with that day-to-day interaction that teachers and school staff have with them. So schools being really prepared for what they're going to hear from students when they come back, teachers being prepared and having the support of where they can go when they learn of what kids are facing or a challenging situation they're having, the behaviors that they're going to see, the fact that kids have not been in a school building and have been like sitting on their chair, out of their chair and taking breaks, to all of a sudden being able to sit in a chair for hours at a time, or finally being able to interact and talk with their friends in a way they couldn't. They're going to want to do that more. They're going to need to do that more, have more breaks, interact more. And so again, setting that expectation from the beginning, not that school's just going to start again like it always has, but it's the school day needs to look different. And the two last points I'd end with, one is having those additional supports integrated into the school. School-based mental health programs and supports are incredibly important, not just for students, but for teachers, that they have an outlet right there in the building that can provide timely support. We have more than 650 schools across the state that have a school-based mental health program, thanks to the Georgia Apex program. There are other types of programs that are funded privately with Philanthopy. We need more of that on-site support, that integration. And that goes for when behaviors manifest, which they will. Some of it is going to be needing a social emotional response, and some of it's going to be connecting to those fundamental needs that students have struggled with, like food access, housing and stability, and having that available support right then and there for students, teachers, and families will be critical. And the last point I'll make is around school discipline. So we had challenges with school discipline before. Disproportionate impact of school discipline on Black and Brown students for same offenses as white students, moving more towards discipline action versus restorative or services and supports. And this is a critical turning point for us as a society to think differently about student behavior and need and to respond accordingly. So re-looking at discipline practices, guidelines, and how we respond to student behavior is going to be really critical, because as I said, it's going to be hard for kids to just sit quietly at a desk for many hours. They're going to have need to express themselves, and for schools to have flexibility and teachers to have the support they need to be able to respond flexibly to those needs. Oh, you're muted, Cathy. Wait, still muted, I think.
I'm not doing it. Sorry.
I think you're good now.
Okay, sorry. Somebody behind the curtain is controlling my mute button. So we've had this year of disruption. How do we leverage it into the transformation we need and want? Because I'm with all of you. Going back, doing what we have been doing that has not been working for the majority of our children would be a real shame. So I open up the discussion to say, what would you like to see? What transformations could we accomplish, and who's thinking about making that happen? And I guess, are you all seeing the slide?
Yes.
Okay. Before we get to answering that question, one of the things that we should think about a little bit is the students that, to Erica's point about there's been a lack of reporting, we've been missing some students. And just to focus on two ends of the spectrum, our kindergarten enrollment from fall 2019 to fall 2020 fell off by almost 12,000 students, almost 10%, which meant that parents made a choice that they were not going to enroll their 5 or 6-year-old because there was no point to the exercise. So one of the questions is, do we think that that will just be made up as things get back to normal? And a related but perhaps more serious question is the drop-off we're seeing in high school enrollment from the fall of 2017, where we saw our 9th grade enrollment at almost 150,000 students, and then the fall of 2020, our 12th grade students, we saw a drop-off of 29,000 students, again, almost 20%. And I fear that it's easier to catch up a kindergartner than it is to recapture a high school student who has decided to leave and not come back.
Yeah, Cathy, I think you're on to something here. I think that, missing children and dropouts, I think there are both in high school as well as those who graduated high school. And, Brian and I work in higher education. Once young people withdraw from the system, be that K-12 or am I going to college, it's much more challenging to get them to re-engage. And those losses really have a lifetime impact. Economists are projecting that, the young people affected by this pandemic are going to have 6 to 9% lower lifetime earnings. And they looked at in Germany, 1966 and 67, a year when they went from starting the school year in the spring to starting in the fall, they shortened the school year. So they studied this group of kids and saw significant declines in learning and followed them over time. So, and there are other examples of where kids have gone through natural disasters and other things. So, it's really concerning that once, a young person withdraws, what are we doing to get them back? And I think an important question is, why should they come back? What are the incentives for them to re-engage? If you graduated from high school and started working or doing something else, what's the incentive for you to move on? If you're a 10th or 11th grader, what's the incentive for you to come back and finish? So there's going to need to be some real thought and plans around even communicating with that group of young people to re-engage them. And we shouldn't, take for granted that the kindergartner, it will just catch up either. I think there's a lot of intentional work that has to be done, lots of specific programs that can be put in place. I'm sure we'll get to some of those to really intervene in a way that makes a difference for children. The other thing I would say is that we've got to ensure that we're not being punitive. For the past year, you disengaged, you didn't sign in virtually, you didn't physically show up. The response can't be, here's your punishment. That's going to be counterproductive to what we want to actually achieve. The last thing I'll just say in this segment is that I think education for me in public health, I've been always passionate about education, but from a public health standpoint, we really see education as a social determinant of health. And, if you don't have strong educational attainment, you don't develop the skills you need, you don't have the opportunities from an employment standpoint that shapes where you live. And in the work I do, there's a real power of place. Where you live in many ways dictates the access you have to a variety of things as well as opportunities. And those things shape health over the life course. So we're really invested in trying to meet young people and families where they are to get them back on track as it relates to learning.
I appreciate Rodney's comments, because I think I'm right there with him. I think that one of the things that I think we probably need, I think language is very important. I think one of the things that we may want to think about is the idea of a dropout versus a push out. I think that many of our children are being pushed out of school. The same way we talking about an opportunity or a service gap as opposed to an achievement gap, right? To put the responsibility on the system, to put the responsibility on us and what we do to children every day. And like I said, this situation existed before COVID. I mean, I think all that COVID has really done is it's amplified these things. It's put it kind of more front and center for us. But as Erica said, we knew about this. It's been happening in our schools for decades. And I think what COVID offers us, and this return offers us, is an opportunity. We can look at this as, oh, this is going to be tough, this is going to be rough, this is going to be a challenge, but we can also look at this as an opportunity. Gloria Ladson-Billings just recently put out a paper where she talks about that she's ready for a hard reset. That perhaps right now, instead of going back to normal, we need to realize that normal did not work for many of our children. And so why go back to normal? We had a curriculum that in many ways did not reflect the identity, the history, the culture, the heritage of many of the children in our schools. We have an opportunity to change that now, right? We have teachers who are employing practices that are not culturally responsive, that don't really respond to the children that are in their classroom. There's an opportunity for us to do that differently now. I started by talking about assessment. There's an opportunity for us to do that now. So I think that one of the things that we may want to look at is when we begin to talk about all the wonderful innovations that we have seen during COVID. Those innovations tend to be things like virtual learning and the use of digital tools. But there have been some other innovations that have also come up, with teachers teaching differently, with paying attention to mental health. I love the fact that we're finally beginning to give mental health some real attention and realize that having children staring at a screen for 8 hours a day just wasn't good for them. So we didn't do it. And we thought about mental health, understanding that children right now during COVID are longing for opportunities to run, to play, and that was something that we'd actually taken out of school. So we realize now that's important. Let's make sure we don't lose that. Let's make sure that we continue to pay attention to the whole child, right? Here in Georgia, our measure of a good school is called the College and Career Performance Readiness Index, or Readiness Performance Index, the CCRPI, which gives this impression that really the reason that we send our kids to school is just for college and career. But we know that it's more than that, right? We know that we want our children to be good citizens. We want them to understand what it means to be a citizen. That should be part of what we're looking for in our schools in terms of education. We want them to be good members of their communities. We want them to be curious. We want them to be imaginative. We want them to engage in the arts. All of these are things that we've taken out of our schools that we now have the opportunity to build back in. Understanding that during this time, kids have had the opportunity to engage in these things, and it's been good for them. So I think we need to, make sure that these innovations, these virtual learning and digital media, those innovations are not the only innovations that we carry with us when we go back, and that we don't go back to normal. Because normal did not work for so many of our children.
Mm-hmm. Let me ask you a question about those innovations. What percentage of the workforce do you think was prepared to do the online teaching? And is there an opportunity to kind of bifurcate the good classroom teacher from the good online teacher and not make the classroom teacher juggle both of the balls?
So I don't know if I have the data on, how many or in which category. Cathy, ask the question one more time. I want to make sure I understand your question.
Well, I think a lot of schools expected the classroom teacher to be both the in-person and the online virtual teacher, sometimes at the same time. should we invest in top-notch online teaching as one model for people who want to stay virtual, or integrate it into a hybrid model and then invest other resources in top-notch in-person classroom teaching?
So I'm biased in this, right? Because I believe that there's something very special about in-person teaching. I don't think the technology is where it needs to be necessarily, with regards to virtual learning quite yet. That being said, I think at the end of the day, the way I'd answer your question, Cathy, is that we consider what is best for our children. And so if there are children that feel like this virtual learning has worked for them and it's been an amazing opportunity, then we prepare teachers to teach in that space. And we do get top-notch teachers across the board, whether it's virtual or face-to-face. Those teachers need to be prepared and trained to do work in that space. But at the end of the day, I think it's whether we're hybrid, whether we're virtual, whether we are face-to-face, I think we're going to have to be responsive to the needs of our children. And so I think that's probably the way I'd answer that question, is that if children find that this type of learning works for them, then I would say, yeah, let's prepare teachers to teach in this space. I tend to be biased, though. I tend to think that when it comes to teaching and what you're able to do when you're in a classroom with your students, I don't think the technology is where it needs to be right now, so that students that are online can get the kind of experience that they would get in a classroom with a very well-trained teacher.
Erica, I'd like you to weigh in on that social connectedness that schools bring. You know, I think we have come to appreciate the critically important role schools play in our lives, and what we miss when we don't have that in-person learning.
Yeah, first, I just want to say yes to everything Brian and Rodney just said. Yes, underscore, exclamation point, all of those things. A big, and I see it in the chat about summer camps. I think one of the critical lessons learned and opportunities here is the continuum of K-12 and the integration of how we think about out of school time, after school, and summer programming. With the traditional way we've approached K-12, and how there can be really strong partnerships there in that enrichment piece, that socialization piece, that connecting kids to things that they're really interested in and excite them, and supporting teachers and being able to meet that interest and that need. There are really cool and interesting models out there that have been tried out of, and especially now as school districts are contemplating extending the school day or extending the school number of months, that what that means for kids and relationships that they have built, those connected relationships with some of the out of school time or enrichment providers, what that means for kids and what they'd be missing out. I think when we think of extended day or extended months, not thinking of it in terms of just more seat time and in the classroom, but thinking about that integration throughout the day with, programming that local community programs, the Y's, Boys and Girls Clubs, and others, and actually bringing that integration with schools and seeing it real as a partnership, a continuum. The other thing I would say is, and to your point about kids not coming back to school that have been disengaged, and making sure that not only is it not punitive, but really understanding why they're not. For many kids, they've started working and they've become the wage earner for their family. And so thinking creatively about credit recovery, or how students are able to get the academic access and enrichment that they need. And that's where I think some of these partnerships with community providers can be really beneficial. So not traditionally thinking about credits the way we always have been, but thinking about education a little bit more broadly across all age ranges.
I'm going to ask each of you this question, but I'm going to start out by saying, if you had the magic wand, what is one transformation you would like to see? And I'm going to start with what we've created with high schools. People always ask me, why is there such a big dropout percentage at the end of the 9th grade? And I tell them it's because that's when students turn 16 and they're old enough to drop out. And I remember fighting the battles at the legislature about raising that age to 17 or 18, and had so much pushback about not wanting to raise the age. And I personally think it's an artificial model. If we let college kids take 10, 15 years to earn a college degree, why should we require high school students to finish their high school diploma in 4 years, maybe 5? And we know we never get them for longer than that. So I really think that we need to seriously rethink what we're doing in our high schools, that for too many kids, there's no reason to stay. But kind of that's my point of view. I'm going to open it up to each of you about what's the one thing you would like to see done differently in K-12 education.
Well, I'm happy to start and leave the sort of issues of pedagogy to the expert on the panel here. I will say that I think, from my vantage point in public health, health's the foundation on which all else rests. If a student is not well, their ability to learn and grow is really compromised. And so we know, looking at the data, depending on the age group, between 25 and 30%, there's been a 25 to 30% increase in ER visits among young children since the pandemic started. I mean, that is really shocking. Maybe it shouldn't be. We know that, as Erica mentioned, abuse and neglect cases are up, and that the mandatory reporters, the people that see the children, teachers, are not seeing them. And so, we know that there are kids that are in situations where their well-being is not being appropriately attended to. And so as we go back to in-person, we're going to need a real, a good approach to assessing the well-being of children. Erica talked about some models of integrating mental health and healthcare into school environments. I think that's critically important to do that. I'll also add that access to healthcare for the past year, many adults, but children as well, have not seen their physicians. Conditions that have gone untreated or uncared for. Additionally, oral health has been another area. So all of these things, children are going to show up, and teachers and administrators and are going to have to pay attention and figure out how do we help the children to be ready to learn. And part of it is they're going to need resources to do that, and some method for really assessing where kids are as they come back.
Rodney, let me follow up on one of the points. One of the risk factors that we saw in COVID was obesity. And I know one of your areas of research is childhood obesity. Do you see any opportunities to do some proactive education about the need to focus on whatever interventions we can bring to play around obesity?
Well, yes, and Brian mentioned the need for kids to be active, to play. I've had the opportunity to work with our state legislature on things around nutrition and physical activity, but I think we need more of that in the school day, and it should be something kids get every day, and that's not what's happening now. So, the school food environment and then the opportunity to engage in activity, those are two very critical elements for developing and maintaining healthy weight among kids. And weight, unhealthy weight is tied to so many other chronic diseases and illnesses, and has, as you've pointed out, Cathy, created greater risk for a large portion of our population as it relates to COVID-19.
And I can say, as somebody who has navigated that water between policy and politics, one of the things we've learned in the past 10 years about school nutrition is the power of the food industry politically to make us focus less on nutrition and more on activity. So all of you are familiar with that fine line we walk when it comes to these policy discussions about how politics can interfere with best policy.
I'm happy to go next, and Brian can close us out. I think the holding on to how important the school community is to child well-being above and beyond what we gave it credit for before, beyond academics. We saw when schools went virtual, the long lines of families coming to pick up the school meal because that was the most robust meal children received in a 24-hour period. For the top leading reasons going into the pandemic of why children were absent for school were oral health, unintended oral health needs, as Rodney identified, and asthma. And then a third has to do with behavioral health. So the more that we can leverage partnerships in schools, to stop expecting teachers to solve everything, but have resources right there at their fingertips to support them, to remove the barriers to learning that kids face, that's going to be critical. So creating those partnerships in school buildings every day, like school-based health centers, school-based mental health programs, enrichment programs, I think that will be critical to child well-being and education success moving forward.
And Brian, let me focus a minute on the impact on teachers in this, because so many of them have children of their own. So they were juggling teaching, childcare, homeschooling. And while healthcare workers seem to have been acknowledged as essential to this pandemic, I think teachers also need that recognition. How do we acknowledge them? How do we, to Erica's point, let them know how essential and valuable they are to our daily lives?
I think that's a great question. I think one, for our parents, for people in our communities, we tell them. I think that's one very simple way. I think, but looking at it from a more systemic level, I think we do the work of protecting the profession of teaching. And I said that earlier as well. And I'll be more explicit. I think I kind of danced around the issue earlier a little bit. So I think programs like Teach for America, for example, I think maybe have very good intentions with regards to giving people who are passionate about serving their communities an opportunity to work in a school. But we're putting these people who maybe are very well intentioned and have a wonderful spirit, we're putting them in the schools with the greatest need, and they're not very well prepared. And so what ends up happening is the children that they're teaching are not getting a wonderful, very well-trained teacher. And then the other thing that happens with this model is that oftentimes those teachers leave after a year or two, and they're replaced by another TFA teacher who leaves after a year or two. And that creates a lot of churn in the school. It also creates the potential for a child to go through 12 or 13 years of schooling without ever seeing a very well-trained, experienced teacher. And that has a tremendous impact on their education. So if we believed in the profession of teaching, if we looked at teaching as a profession in our country, that would never happen. We would never allow that to happen. So I think one of the things that we can do to acknowledge the hard work of our teachers, our professional teachers, is to protect the profession, to acknowledge that this is a profession, that these men and women have trained and worked very hard to master their craft as teachers. I think that's one of the things that we could do in this country, to actually acknowledge what they give to us every single day. And I think a lot of parents quickly discovered what it means to be a teacher during this COVID crisis, and now understand this is not something that you can just walk in and do. It takes training, it takes preparation. I think as a community, we need to acknowledge that. Cathy, do I get to wave my magic wand?
Yes, please do.
I want
Wave
to
a
wave my
couple.
magic wand too. So so when you asked that question, I think immediately my mind went to, that's tough for me to answer because I think about this problem as systemic, right? So I think if I were to wave my magic wand, I would create a collective shift of consciousness with regards to race, class, gender, xenophobia, right? And the oppressions that are connected with each of those things. I think that we see disparities in our schools because our schools sit in this culture that is America, and America has never, ever dealt with this part of its consciousness. And so what ends up happening is our schools reflect racial injustice, class injustice, sexism, and other types of injustice that we see in our larger society. So we know for a fact that the kids that were most impacted by COVID and the kids that were most impacted by public education during COVID were our Black and brown children, our children who did not speak English as their first language, poor children, children who suffer from the digital divide, refugee children, the very same children whose parents suffer in the larger American context. You know, so and you gave me a magic wand, so it's a big ask, Cathy. But I think that's what I look for. I look for a shift in our collective consciousness with regards to what is justice and how do we create a society that's actually embedded in justice. So, yeah.
And what is a first step in furtherance of that shift in consciousness?
Wow, Cathy, you gave me a magic wand. You didn't say I had to figure it out. I think so too, right? I think public education plays a key role, right? Public education in so many ways reinforces what we see in society. It reproduces it, right? So let's change the curriculum of our schools so that kids have access to information which would help them to cultivate this critical consciousness that we need as a nation. That's one thing. I think for our adults, I think we need to begin to have some courageous and honest conversations, right? Truth and reconciliation begins with truth. And so I think we need to begin having some honest and very truthful conversations across, communities so that we can begin to share our experiences with each other and begin to learn from each other. I think we need to begin to do this work, but I think it's going to start with conversations and communication.
Rodney, what is your magic wand going to bring us?
Wow, it's tough to follow Brian. I mean, because I think what Brian has said gets at really the core of some of the challenges that we're seeing. The disparities around learning and access. Some of the things I've seen suggest that we could see up to 12 months of learning loss among the most vulnerable children, homeless, low income, underrepresented minority students. And I mean, that's a year, and so that really should give us, real pause. I don't have anything to add beyond what Brian said, because he's trying to change the world and the system. And I think that's what we ought to be doing. So, I'm behind him on that. I suppose I would say, as we think about systems, though, that on the health and public health side, part of the struggles we've had is our inability to manage this pandemic. And so if we make better investments in creating a system that can support the population not if these infectious disease threats, we will be better positioned as a society to maintain what we're doing in education and industry and business and other sectors. There will be less threats to employment and income, and thus greater security for children and families. So I think there's a real need for a recognition of the value and importance of public health to this entire conversation as well.
Well, and to follow up on that, Rodney, a lot of us felt like we were building the plane and flying the plane at the same time because we were so unprepared for this. So my question to you is are we prepared for the next one?
I don't think so. And I think part of the reason is that we're a very reactive society, and I think there's much more that we can do to create the infrastructure and systems that are needed to allow us to respond effectively and proactively prior to things going off the rails. I mean, I'll give you an example. You know, how long did it take us to stand up a testing infrastructure? And if we had to stand it up again in 2 years, could we do it? I don't think we could. The private sector healthcare, public sector healthcare, public health infrastructure, and pharmacies, each are playing, you know, a role on vaccination, and it's not clear that they talk to each other well or have a system to communicate well. You know, our ability to connect with the private sector when we need to and scale up their engagement and their contributions. We don't have a system for that at present. You know, people have to pick up the phone and hey, can you? So we've got to build a system, and that's not what we have presently. So the last thing I'll say is just in our health departments, there's not capacity around, you know, data management, epidemiology to the extent that it's needed. And if that kind of capacity and leadership is not embedded in local communities, there's not an ability to be out front to prevent, which is the goal of public health, these outbreaks.
I think those of us who know education pretty well and understand the fragmentation of policymaking among 180 local school systems now understand that the same thing exists in public health, because it is also essentially a county-based or city-based decision-making authority. And so that's why it was hard to understand why there wasn't a plan from the get-go. So if for nothing else, we now have a greater appreciation of how public health operates or doesn't operate, and that it's not so dissimilar to things like education.
Yeah, and I think, Cathy, the only thing I would add, you know, we tend to take a person-focused mindset versus a system-focused. I mean, you see that in the data that we look at, focusing on only child outcomes, but really that's all a manifestation of our system. All the things that Brian said and Rodney said is how our systems are designed for some students to succeed more than others. And until we start putting equal or more, I would say more weight on the data that tells us how our systems are functioning, how we are investing and where we are investing in kids, and have that mindset shift in recognizing that and putting focus on that, the outcomes aren't going to change. So being able to put greater focus on the systems that really say the kind of access and investment we're giving our kids and communities.
And I think that requires structural change in who's making the decisions when it comes to K-12 education, because we are such a local control, county and city-based organization that the systems who can do and the systems that can't don't. And so some kids are working hard to just survive and other kids are thriving. And we don't seem to have a mechanism to level the playing field for all of our K-12 students. But let me ask one of the questions that has popped up in our chat to see if any of you have something that comes to mind is, were there some best practices that came out of the pandemic experience that you hope we keep?
Well, I'll take a shot, and you know, these aren't education necessarily related, but I think as we come out of this pandemic, you know, positives, things that we should hope to maintain. I think, you know, families have been forced to be together, and I think for the better in many cases, but not in all. And so, that connectedness that we have with family, I think is central for many of us, and especially for the well-being of children. For those of us who had the privilege of working remotely, it redirects available time, and at least in my household, available time that is really for connecting with family and supporting children. So that's another thing that I think is valuable. I think the lesson that we could all step away from this pandemic with is that we've learned that we can, across many sectors, not all, function very effectively in a virtual mode. And so I think there are ways that we can leverage that as we go forward. The last thing I'll say is that I think as it relates to inequities and disparities, I'm hoping that we recognize them even more now as a result of the pandemic. I think the summer we had last summer around racial inequity and racial justice certainly opened people's eyes to some of the realities in our country, but the pandemic further pulled the curtain back. And so I'm hoping that as we come out of the pandemic, that we can make meaningful and sustained investments to address the inequities that exist in our society and that make it difficult for some of our children to thrive and to achieve their full potential.
I've been inspired by some of the things I'm seeing in classrooms. I've been inspired by the discourse that I see in classrooms. So students taking an active role in their learning, and the expectation from our teachers that students take an active role in their learning. So I'll my son will be on in one of his classes, and I'll of course be listening in because I love teachers and I want to hear what they're talking about. And the conversations that I'm hearing between the students and the teachers are deep and engaging. I mean, I think that's what we want in our classrooms. And I think it's happening because teachers realize that they don't just want to sit and lecture at a screen and talk to a screen. And so it's really changed the dynamic of the classroom community. And I think that's something that I'd love to continue to see. I'm really happy about the focus on our children's mental health. I think that's something we should definitely move forward and take forward. I'd add, however, I don't think we've given quite as much attention to our teachers' mental health. And I think we need to make sure that we pay attention to the entire community and the teacher is a part of that community, and make sure that we pay attention to what their mental health needs are. But the fact that we've thought about the fact that, we can ask our children to read and to write and to study and to engage online, but we also have to think about how that's going to affect their spirits, their soul, and their mental health. And we can't just ignore that. And I think the history of our schools has taught us that we don't always pay attention to our children's mental health. So I would love to see us to carry that forward. The other thing is, and I don't know how we would do this because I think that people are talking about extending the day, but we've created spaces in the day for our children to have freedom, right? To just do what they want to do. And so much of our children's lives are scheduled now. They have very little free time to do what they want to do. And I think that's important to create those spaces. And so I know that my son enjoys those moments between classes when he just gets to pick up a book or play a game. That's been important to him. So I think it'd be nice if we could figure out ways to weave that back into our schools when we go back.
And Brian, let me just follow up on one point you made about teaching workforce. I read the other day that contrary to expectations that the teaching workforce would have declined during the pandemic, it has actually increased, which I think is a very positive sign. And what I hope the larger public has learned is the importance of having someone in that classroom who can connect with a child and that it will encourage a broader spectrum of young people, middle-aged people, older people to go into the profession. Because we've, in the past, created this job that sets up many teachers to fail with inadequate resources to do the job they want to do. So I am optimistic that we have put the spotlight on what challenge it is to be a good teacher, and that we need so many effective teachers in our classrooms. And Erica, I'd love for you to close us out with your thoughts.
So many thoughts shared today. I just wanted to quickly note the question in the chat about the recess bill, which is something that our organization fought really hard for and believe is really important. And it comes down to some of Cathy's point about local control. And this would mandate something of all school districts. And the need to maintain local control is really strong. And so how we as a society, put a stake in the ground of fundamentally these things are important, that we all agree that these things are critical and important. Things like recess. I think the shift in reframing is important. So I touch a little bit on recognizing the system challenges and how our system is designed, how that impacts kids versus really actually saying something innate with a child or pathologizing children, which we do, instead of acknowledging the fact that it's not them that lost learning. They didn't have instruction. It was a loss of instruction, loss of connectivity. And so I'm hearing that more and more though in dialogue. And that's, encouraging to me, that I don't think we have anywhere close to the full shift that we want to see, Brian, that you outlined, but more and more I'm hearing empathy, questioning, of wanting to understand, and a shift in framing to focusing on how do we make sure children have what they need, versus, quite frankly, blaming them or labeling them as something wrong with them if they're not showing up in the way that we expect them to, and recognizing, not asking the question, what's wrong with you, but instead, what happened to you, or what do you need, or what's going on. So I'm hopeful that I'm hearing that more and more, that shift in thinking and framing. And I think with the federal dollars coming in, there's a great deal of opportunity to reimagine and invest differently, and invest more equitably in our communities and our kids. And so I'm going to hold on to that hope and put some action behind that, and encouraging some of that investment differently than how we traditionally have.
Cathy, would it be possible for me to ask Brian and Erica a question?
Absolutely.
So, one of the things we haven't talked a lot about is the specific strategies for addressing particularly the academic needs of children and that are going to be returning to school. And some of the reading that I've done, there are lots of ideas. And so I'm curious to hear from some experts in that space about, things like, one of the suggestions that was made in a McKinsey report recently was an investment in acceleration academies that sort of target single topics over a week, maybe on a break, so 25 hours. That those have been shown to have some positive effect. High intensity tutoring, one tutor, two students. I think Erica mentioned, or Brian, extended school day. Those sorts of things. Summer programs. I'm just curious. Maybe Brian, your thoughts on what are some of the specific strategies that you think the education sector, K-12, would do well to consider as we move into this summer and the next academic year?
I love the idea of kind of looking at, as our kids move forward in terms of the content that they're expected to learn at the grade level, I think one of the things to look at the scope and sequence for that year, what our kids are expected to learn. I kind of mentioned this earlier, and adjust, right? To look at, the fact that we may not be able to cover everything that we thought we were going to cover this year, and to just adjust. I think that's the first thing. But then to move away from remediation. I don't think remediation is going to be the answer for us, like days and days of teaching what you should have learned last year, this year. I think that we can continue to think about enrichment and continue to think about actually teaching our children, and that where there are gaps in their learning, where there are, there's prerequisite knowledge that they need, we can teach that. And then where there are deep gaps, I think that there are opportunities for wraparound services. I think tutoring and things like that are possible, and they may be good solutions. I'm hesitant to talk about things like extending the school day, right? Because I believe that school is one of the things that our children do. I don't think it should be the only thing that they do. I love my children dearly, and I would like some time with them. I'd like to spend time with them too. I'd like to teach them about who their father is and the history of their family, and spend time exploring our community. There are things I want to do with my children as well. And so I would hate for school to take up more of the landscape in our children's lives. So I think if we can figure out ways to adjust the curriculum for this year so that we can be reasonable with our expectations, continue with educating them for grade level content and looking at enrichment, and then where needed, provide the support they need to kind of pick up that information that they're going to need to move forward. I think that's a better solution than just remediation or trying to reteach what they didn't get this past year. And honestly, Rodney, I think this is going to be something that we're going to have to deal with for many years to come. We're going to have to continue to think about this for many years to come. But like I said, we've got an opportunity now to really do things differently. Let's take advantage of that opportunity. We don't have to continue doing it the way that we did it before.
Thanks so much for that, Brian. It's very helpful.
I agree. I think, we often hear or approach things like, we can't possibly do that. We can't do that. We can't do that. And pandemic happened, and look at all the things we did. Look at what we did. So I think when we think about summer, next school year, after school, summer after that, we can do some things differently. We can, and we should. And so let's not limit ourselves in that possibility. We could reassess what kids should learn in the next year to allow for that enrichment in other times, and other experiences, versus trying to cram everything in by a pre-established mindset and framing. We can do that. We can think differently about that, and just keep encouraging ourselves to give ourselves the courage to think and do differently.
Well, thank you all. And before I let everybody go, I just want to say how grateful I am for your willingness to participate. Brian, I'm going to put it to do on your list, and that is, because our next webinar is about the impact on working women, I would love for you to put me in touch with a teacher, if you know one, and not to diminish in any way, shape, or form you men who are parents who have been working and impacted by this. But if you have a teacher who could bring this to life about what the emotional and toll has been on a classroom teacher, I would love to get that contact information.
I'll be happy
and
to.
I want to bring our discussion today back to Georgia State, where we started, because unfortunately, while we can't solve our K-12 problem today, I did want to let our audience know about a need we have here at Georgia State. Many of our students at Georgia State mirror the demographics of what you see in our K-12 population, and probably the strongest correlation is that poverty metric of 60% of our students at Georgia State being eligible for the Pell Grant, which is a measure of poverty. Georgia State has something called the Emergency Assistance Fund, which in this pandemic has made the difference between some of our students being able to physically get to class by being able to buy gas for their cars, being able to buy food, being able to provide childcare, being able to afford hotspots. Over the past year, 851 grants have been given out, over $400,000 to our students. 70% of the recipients are female students. Their average age is 23. 67% of our recipients are African American students. 74% were awarded specifically to provide food vouchers for the student or his or her family. And over 1,000 of the recipients have children that they're taking care of. So think about our student population at Georgia State trying to go to school, trying to oversee the education of their own children, make up for the lost jobs that many of them have. So if anybody in our audience wants to know a way to help, because I always get questions after the webinars about what could I do, I just want to let you know that there's something called the Emergency Assistance Fund here at Georgia State for our neediest students. And if you need more information or want to find out more or donate to, you can go to, there should be another slide coming up, impact.gsu.edu/project/20441. And that is the Emergency Assistance Fund here at Georgia State. So again, I thank you for your participation. I thank you for watching. I hope you'll join us for the last webinar of the fiscal year about the impact of COVID on working parents, specifically moms and mothers. And that should be coming up the last week of May. So thank you all. I hope you leave informed and inspired.